In this presentation, I'm going to talk about oral health strategies for the prevention of pancreatic cancer and also for patients under treatment for pancreatic cancer. Once again, research is showing a connection for some odd reason of oral pathogens and pancreatic cancer that I want to touch on here. And I want to, like I said, I'm touching on these individually. We're not having the conversation that's saying, you know, your oral health has implications for your overall health. We're breaking it down into the research that's showing the specific issues. And I'm doing that for a reason, because I think I'm making a very compelling argument as to why we need to more aggressively attack this oral environment, because it's affecting a lot of things individually. That's why I'm breaking it down individually. Okay, so once again, we'll work with your primary care physician or oncologist if need be in coordinating a treatment plan. Here are the established pancreatic cancer risk factors: tobacco smoking, pancreatitis, obesity, type 2 diabetes. Okay, so this is current research. Individuals with periodontal disease have elevated markers of systemic inflammation, and oral bacteria can disseminate into the blood, stomach, heart, and even reach the brain. These infections may contribute to the progression of pancreatic cancer by acting jointly with other pancreatic risk factors. Okay, the oral pathogens implicated in this study: PG. I have mentioned PG in almost every presentation that I have. This bacteria is showing up in really bad places. Okay, it makes perfect sense to me as a doctor that if I can eliminate this from my body, it's probably a better thing than having it in high levels in my mouth where it can enter my bloodstream. Okay, it's common sense. Okay, I don't have to be like a super scientist to get that. Okay, so if you're at risk for pancreatic cancer or under treatment, we need to look specifically at PG, and this is the test that looks at that, and we need to treat. Okay, if you have an elevated level of PG, we need to talk about going through this oral disinfection protocol and eliminating or reducing the levels of PG. It only makes sense. Okay, so the treatment objectives, very, very similar to the previous protocols. Find an interval. Let's get your mouth in balance. Find an interval. Find the products. Let's do the, to do the disinfection. Same thing. Home care products. None of this is really different. Each one of these has a tiny little different component. Like I said, the pancreatic cancer being tied to PG, that's a little bit different than the others. But as far as like the treatment and the recare, they're all very similar. We determine the level of bacteria, we want to get it to a healthy level, and we want to keep it there, okay? No different than how your primary care physician attacks cholesterol, okay? They want to get you within a healthy range to give you the chance to have optimum health. Same thing here, okay? We need to treat the bacteria to get things into a more optimal level.